Over the past decade, there's been a dramatic increase in the amount of money and time devoted to research studies and clinical trials involving psychedelic compounds such as psilocybin, MDMA, and ketamine. Of the many compounds being studied, to date, the only medicine that is legal to use in clinical settings is ketamine. At CIT clinics, we have observed a welcome shift away from procedure-oriented ketamine clinics where patients are simply infused with standardized doses of ketamine in a very medical setting, into a more integrated approach where ketamine treatment is combined with engaging and compassionate psychotherapy and even mindfulness training. This new approach is called ketamine-assisted psychotherapy, or CAP. And CAP is very intensive, demanding, and profoundly effective for patients and highly rewarding for its practitioners. At CIT clinics, we're committed to supporting all non-medical providers who wish to offer CAP to their patients in a legal, safe, and medically efficacious manner. Here are some examples of how we can support you in this process. Ketamine is a controlled substance and requires a medical license to be administered legally. Given the effectiveness of CAP, some providers may be tempted to administer ketamine to their clients without a medical license. They risk their professional license at best and possible criminal charges at worst. CIT Clinics is addressing this issue by enabling carefully vetted, non-medical providers to administer ketamine through the CIT Clinics medical license. Our goal is to support all qualified CAP providers so they can treat their patients legally and safely. For most people, the hemodynamic consequences of ketamine administration are akin to moderate to vigorous exercise. Ketamine is incredibly safe. However, when things do go wrong, they can result in extreme mental and emotional anguish and even serious physiological issues, such as cardiac, liver, kidney, and even respiratory distress. As anesthesiologists, we are trained to anticipate the worst, no matter how unlikely it seems. Providing CAP to your patients without a comprehensive clinical safety net is taking unnecessary risks for both you and your patient. When you provide CAP at CIT clinics, you're able to hand off all clinical responsibilities to a highly skilled and licensed medical team, so you can focus your full attention on guiding your patient through their CAP session. As board-certified anesthesiologists, titration of intravenous medications, simply stated, is the essence of what we do. Say your depressed patient is on the edge of a breakthrough, and you'd like to deepen their experience as well as lengthen their CAP session. In this scenario, you simply push the call button, discuss your request with the CIT anesthesiologist, who then administers a bolus of an additional 10 milligrams of ketamine. This all happens without you needing to get up or leave the room. Conversely, imagine a PTSD patient's session suddenly becoming heavier and darker than you believe they're ready for. Rather than muscle through and endure the situation, you can push the call button, and a CIT anesthesiologist is by your side to turn down the infusion and discuss the possible administration of an anxiolytic medication to soften your patient's journey. In both of these scenarios, our goal is to support you and your patient so you can stay fully focused on your session and the healing process. Providing successful CAP sessions requires attention to many complex details. Ideal set and setting are the result of deliberate planning and execution, thereby setting up the patient for an optimal experience. When you offer CAP to your patients at CIT clinics, all of these details are taken care of for you. The rooms are set up for CAP with comfortable recliners, music of your choice, and various lighting options. The environment is COVID safe, and all of the standards of a medical clinic are met. Our staff is fully responsive to your needs: clinical, administrative, patient communication, follow-up, and more. We worry about the details so you don't need to, so you can focus completely on your patient's road to recovery. I hope this gives you some insight into how CIT clinics can support you. We're fully committed to supporting skilled and trained non-medical providers to be able to provide CAP legally, safely, and effectively. If you're interested in learning more about how we can support you and your patients, please don't hesitate to reach out.